Hello and welcome back to the East Lake Pet Talk podcast. I'm veterinarian Dr. Karen Fling, joined with my co-host today.
Hello everyone, I'm Dr. Will McCauley. Welcome back to the podcast. We always love having you here. We also love sharing all the news that's going on at our clinic, East Lake Veterinary Hospital.
That's right.
Some new fun happenings
Yes,
going on.
well, and happenings that wound up being fun after all, but might not have been so fun. I'm going to see if Roderick can show a picture of this x-ray here. Roderick, can you pull up that x-ray for us there? Okay, well, great. Well, take a look at this and tell us what your diagnosis is. Let's see how many people can figure this out. Okay, and here's another view. Take a look at this and see if you can zoom in a little closer and recognize what is a very familiar object around the house, a safety pin.
That's right.
Yes, and so this precious little dog came in and just wasn't feeling quite right, just a little bit off, nothing specific, still wagging the tail, still happy, maybe a little off on the appetite. And here's Dr. Nickel and the patient and her nurse, Kirsten. And does this dog look like a dog that would get into this kind of trouble?
Doesn't look like it to me, but it did.
Absolutely. And kudos to Dr. Nickel for having her sharp diagnostic skills to figure out that, boy, this dog really needed an x-ray. And she said, I almost didn't because this dog looked so good. But with the history of just being a little off, she figured it out. And it turns out this safety pin, thank goodness, was limited to just the safety pin in the tummy. But what we didn't know is if there might not be a string attached to this or some thread or some other material along with the safety pin that could cause even more trouble and damage to the intestines. But thank goodness they were able to uneventfully go in surgically, get the safety pin out. And that's a good thing, not only from the standpoint that if this thing had come open or, potentially perforated intestines, we could have had much bigger trouble.
Or if it did have a string on it, people don't think that a piece of yarn or a piece of twine or something, that if a dog or cat ate, that wouldn't be as bad as, say, a rock or a stick or something. But in reality,
it can be deadly.
They can be the worst. Some of the worst ones I've ever seen of these gastrointestinal foreign bodies have been string or linear foreign bodies, because what they do is they make the GI tract bunch up and they just saw through that line, through that muscle wall.
To literally cut through that intestine. It can be deadly.
It can be very bad. So thank goodness, and for Dr. Nickel, and thank goodness also for that pet owner that said, the dog's just not quite doing right. It's not, on death's door by any means, but I think I'm going to be on the safe side and take it in to at least have an x-ray done, have an exam done, and it could save this dog's life.
Right, and even with the safety pin, even though it was closed with the size that it was, it probably would not have passed. It probably would have sat there in the stomach. And then what we see is when we have metal objects that sit in the stomach like that, sometimes the stomach acids acting on that metal cause other metals to leach out into the system that cause liver disease and various organ dysfunctions that can even be life-threatening. So happy to report this little one went home uneventfully. Everything's going great, and we're really pleased about that.
That's right. So that was some good news. And some other good news as well. One of our longtime ELPOs that had been with us for a very long time.
One of our little pet orphans, Tulip, went home.
She went home. She found a home in Colorado, actually.
Yes.
And we got some good pictures of her to show as well. She was a great pup.
Great dog. And she is probably, a Staffordshire Terrier, pit bull cross of some sort. And sadly, so many of these dogs that have that lineage, people are scared of, or they're afraid to adopt them, or afraid of that stigma that sometimes is associated with pit bulls. So poor sweet little angels like Tulip sometimes really have to wait for their forever home. So it really does take a village sometimes to get these dogs adopted. And you can see here the airplane and pic there where she got to fly to Colorado, and
first
that was
class,
first
private
class.
Plane.
Exactly.
Pretty nice.
And we do have other orphans that sometimes we make matches for outside of the Dallas-Fort Worth area here in Texas. And we also have a private pilot that's on our volunteer group.
I did not know that.
Yes, Robin. And he's happy to fly these pets to wherever they need to go for their forever home. And we're actually hoping that our Pet of the Week, Rose, may have that opportunity, just like Tulip did. And this is a picture of Rose. She is a precious dog, really an energetic, active dog. I think she would do great as a single dog in a household for somebody that's super athletic and loves to run and exercise.
Yes.
Oh, yeah. She's truly an athlete, just incredibly muscular and just really well built. So
and well behaved, too. She has a lot of energy going on, but she's very sweet, very loving.
Yes.
And so,
very, very loving.
Yep.
And we've had her, I don't know if you realize this, but she's been with our orphanage, East Lake Pet Orphanage, which is no kill, for close to 8 months now.
I remember she'd been up there for a while.
Yeah, for a
as long as I've been up
while.
there.
And same kind of thing like with Tulip, where some of these great dogs that are highly adoptable just get passed by because of the stigma associated with them. So if you know anybody that is interested in Rose or other great adoptable pets, please feel free to call us at 214-342-3100. And if you'd like to reach us here on the podcast, how should they do that, Dr. McCauley?
You can always call and leave a voicemail on our line at 972-808-6038. If you'd rather send us an email, drop us a question. It's at podcast@welovepets.net. Of course, we always recommend you subscribe via the YouTube link or go through iTunes. Find the little link in the description below.
Very good. Well, something we've been thinking about here lately is cold weather.
Oh, if there's one word to describe Dallas right now, it is cold weather. It's been.
And they just upgraded or downgraded, I don't know how you say that, but they say it's even more of a concern between today and tomorrow than they originally thought relative to the cold and snow and wintry mix that's ahead of us.
Exactly, the sleet and everything. But that brings us to a good point that we need to be worried not only about our safety out on the roads and everything, but for sure our pets when they go outside. I think even in this day and age, some people have outdoor pets only. They stay out all the time, and regardless of what your belief in that is, cold weather like this is
it's hard on them.
It's no place to keep your dog or your cat or any animal outside.
And
like
even
that.
though you may have a dog with a really dense coat, a dog that has a little extra insulation, even those dogs, when these temperatures get down in this freezing range, it's too cold for them to be out.
They need a sheltered place to be in. Whether it's a warm area in the garage or a place in the laundry room or something like that.
Right.
There's actually a lot of information out there. One of the best places we recommend you go is the AVMA website, avma.org. They have a lot of things about checking your dog's paws for cracking, because of the dry, cold weather.
Right, and they also recommend that you clean your pet's paws when they've been outside, because you may not be able to see it yourself, but there can be ice or salt that people use to melt ice, the de-icers, chemicals like that can damage the paws, and then also antifreeze. You never know where there can be a little spill of antifreeze, and just a tiny little amount of that antifreeze can be enough to kill a dog or a cat.
They lick their paws after they go through it. Yeah,
they do.
Yeah, and another thing that I was reading on here that I didn't think of, but makes a lot of sense, is to, before you go start your car, make some noise around that car.
Rap on that hood of the car.
Exactly, because you don't think about it, but some cats, if it's not your cat, some feral cat will go get up onto the
just
engine
trying
block
to seek out heat
because
and
it's
warmth.
Heat, it's warm, it's a nice sheltered area, and if a belt catches that cat, that could be deadly.
Right,
and so
absolutely.
make sure that they know that you're about to start the car up.
That's a good thing to do. And you talked about shelter a moment ago. There are some creative things. I know we talk to people all the time that try to protect the feral cat colonies that are out there and help them. And, of course, I worry about my chickens. I have chickens at home, and I don't bring the chickens in the house, but we get some little plug-in lights that we put in their coop, and that keeps them warm and toasty, and then we close up the coop to keep them safe. But for outdoor cats that may come and go that you may not be able to bring in, you can fashion neat little cubbies made out of styrofoam ice chest. You can plug in little extra lamps, like a little shop lamp on a porch area will radiate a lot of heat just with an incandescent bulb.
Yeah, those low-tech, low-cost fixes can really make all the difference between,
life
tragedy.
and death sometimes.
Yeah, exactly. And, of course, you want to make sure that your pet is always in good condition when they go outside, so the best thing to do is to get that yearly checkup with your veterinarian.
And for my own pets, because I have so many, even for me, it's a little bit to keep up with and remember sometimes, gosh, have I had annual lab testing done or everybody's shots up to date? So I always make it a plan in this early part of the year when temperatures are cold, kind of once I get through the holiday hustle and bustle, that this time of year is when I update everybody. So that's kind of my late Christmas present to all the pets, and it's a good time to make sure that your pet is in good health and able to withstand colder temperatures. And just because your pet's always done well with it in the past doesn't mean that they will again, because body condition changes. Weight loss can be more of a concern when there's colder temperatures. They just have less insulation.
Right.
And if a pet is starting to develop arthritis, this is the time of year when it's really tough on them. And even if you have them in the house, it's gets cooler down at the ground level on the floor where a lot of these pets are, and that can be tough on the arthritis too.
Just like in humans, though, when the temperature drops, joints can get achy and creaky.
Indeed.
And so you need to keep them warm and keep an eye out for progressive joint issues that need to be addressed by your veterinarian.
Absolutely. So if you haven't had an annual checkup for your pet within the last year, make that call today and make sure they're fit and ready to handle the season.
That's right. Well, that's for the cold weather stuff. You know, we did talk or hinted at last week about talking about another big issue, which is kidney stones. I know we
we had a listener or a viewer that had
right.
responded about that, and they had a specific issue with a kidney stone, and they asked us to recommend a diet for kidney stones, and that's kind of a tricky question, isn't it?
It is. Yeah. So there are multiple, things to do for kidney stones if your pet has them. The first, of course, is to diagnose and treat the one that is there. And when we say kidney stones, that's actually what's called a renolith. But there are other areas that stones may form. They can form the bladder, and the ureters, in the kidneys. What we normally see, at least what I've normally seen, are bladder stones.
More commonly in veterinary medicine, whereas I think on the human side, perhaps they may see more true kidney stones.
Yeah, exactly. But usually by the time we see them, a dog or a cat will come in, and they'll have just this kind of I can call it a wishy-washy history of this urinary issue that may come and go. We may have treated it several times with antibiotics, thinking it's a
bladder infection only.
Yeah, but then if we shoot an X-ray, you can usually see a nice big stone or tons of little stones, little concretions in the bladder.
Right. So definitely, if there are recurrent urinary tract infections, look for those stones because they can be there. And I say the question about the diet is a tricky one because depending on what type of stone you have, can make a 180 difference on what kind of food you should be feeding.
That's right. There's not just one type of kidney stone. I mean, there's struvites, there's calcium oxalate, there are, I think of the others.
Urate.
Urate stones, in Dalmatians especially.
So lots of different kinds. So depending on the kind that you have, that determines the diet you should feed. And in certain stone cases, like you mentioned, the struvites, sometimes just by changing diet alone, you can actually cause the total resorption and dissolution of some of these stones. Right. So that's great news. But other types of stones sometimes don't show up on X-ray. Some of them have to be diagnosed either by ultrasound or by surgery. So it depends. So for any of you out there, if you have questions about stones, let us know what kind has been diagnosed. Sometimes it can be diagnosed from a urinalysis by where crystals are shed, and basically crystals are like building blocks to bladder stones. So you can actually diagnose what type of stone is in the bladder by a probable
under a microscope and see what kind of structure the crystal is.
Yeah, exactly. So happy to discuss different diets relative to different stones. And what's interesting in cats is that very many cats are prone to struvite stones early on in their life, and then something happens when they crest to about age 7, and then all of a sudden they're more prone to oxalate stones. So the diet you fed when they were younger may not be the diet you want to continue on with as they mature in age and crest over into that senior category.
It's a different disease, actually, going on. Same kind of process, but different
mechanism.
Different mechanism, exactly.
Right. So if you keep on that same food, it could be that you're promoting the development of another type of stone.
Haven't had problems till they hit that 8-9 year range, and then all of a sudden they're having stones again. And so the question, what food should I have my dog or cat on that has previously had stones? Not so simple. Just say, oh, go with this one, go with that one. Have to know.
Right. And definitely bring your pet's veterinarian into the loop.
Yes.
And then sometimes there are nutritionists that we even consult with in the cases where we have kind of tricky stone cases.
Or multiple stones.
Right. You can have multiple types of stones, or a center of a stone that's one type and an exterior that's another. So
the world's worst little pearl.
Yes, indeed. Not the kind of pearl you want.
No, definitely not.
Yes.
So that's we love those kind of questions. If you have more of them, of course, send them along to us. We'd love to answer them on the air.
Right. And something else we want to talk about is about dental disease. We kind of mentioned last time that traditionally February is a time of year when people recognize Dental Health Month for pets, or in March at Eastlake. We celebrate that month in March here. So it's a great time to talk about preventing dental disease in your pets, your dogs and cats and pigs or whatever you have, because the statistics show that 75 to 80% of dogs or cats actually have oral disease by the age of 3. So that's incredible. That's pretty high.
Yeah. Well, think about it. If you believe, if you go with the assumption that dogs age between 5 to 7 years as fast as humans, that's going the equivalent of 21 years without brushing your teeth sometimes.
Right.
If you've never brushed that dog or cat's teeth in your life, then of course you're going to have dental disease.
So if you're not sure whether your dog or cat needs attention, go ahead and flip that lip and look all the way back to the very back of the mouth and look for any discoloration, any chipped or broken teeth, any calculus or dental debris. Those can be signs that you really need some professional attention. And if the good news is there and you don't have any of those issues, then preventative care is fantastic. That can help keep your dog or cat out of the dental chair. But where dental cleaning is needed, professional dental cleaning or other care within the mouth, it's something I can't recommend highly enough.
You can avoid so many problems down the road by doing it getting started early and just keeping up with that yearly dental.
Very true.
People think it's way too often to do it once a year, but again, it's the equivalent every 5 to 7 years if you're a dog or a cat, and so it's really in some cases not often enough. And so I think 1 year is a happy medium. Every year you come in for that checkup, those vaccines, and get that dental done if needed.
Oral health checked out, because really there's probably no other medical procedure that we do that does more to impact a pet's overall health and extend life expectancy. Wouldn't you agree?
I've seen cats come in with horrible resorptive lesions or ulcerations, and you go in there, clean
basically
the teeth
like
off.
Cavities and some of those teeth.
Pull the problem teeth out. They go home and they go back to eating. They're much more friendly. They let you pet them on their face again, which owners have said that's one of the biggest things. They won't let me pet them on their head, and so it can really change the whole course of a dog or a cat's life.
Well, one of my most favorite references to a patient like that was with a kitty cat, where the owner came in. We identified that there were some dental issues. We went in, cleaned the mouth up. We found a bad tooth that did need to be extracted, removed that tooth, and the cat's whole personality changed. And so the owner after that laughed that we'd removed the evil tooth. So
there's some truth in that.
And dental disease is painful.
Oh, if I had a tooth like that, I'd be in a sour mood too.
And they can't tell you. And so there are so many pets that suffer silently with dental pain, with oral pain, and they can't tell us. So it's up to us to intervene and step in there and do what we can to help these pets. And I'd probably say, 50% of the time when we go in for a routine cleaning, don't you think we find some surprises in there?
Yeah, that's probably about right.
Cavities or cracks or other things that sometimes are much more serious.
50%, probably a good estimate.
Yeah, probably so.
Yeah.
So if you haven't had that oral checkup for your pet recently, then please schedule that with your pet's doctor. And I know at Eastlake we offer complimentary pet dental checkups during the month of March. So even if you're not sure whether attention is needed there, or if they need something more involved like a professional cleaning, we can help you to know that, and then hopefully get on some good home health care.
That's right. Well, cool stuff. Well, I know next week I'm not going to be here. I'll be traveling to actually go to the AVMA for a meeting, but we will have a guest in.
Yes, we will. Yeah. And we have a representative coming from the Verback company, and so I'm really excited to hear about some of their new products.
Me too.
And they really do a lot in the way of home health care, and that can be not only through toothbrushing, but with great treats and products that just really help prevent dental disease. So it's good for pets all the way
perfectly
around.
Into what we just talked about.
Yes,
That'd
indeed.
be great.
So more to follow on that. So we're about out of time for today, but please give us your input, your feedback, your questions, information that you really want to hear about from us. That's what we're here for. And again, how should people provide that information to us?
Shoot us an email at podcast@welovepets.net, or give us a call. Leave us a voicemail at 972-808-6038.
Well, we're about out of time, so we'll be back same time, same place next week. Thanks so much.